Hi, good morning. My name is Professor Tom Cherian. I'm a liver transplant surgeon and a liver specialist. I run this hospital called South Asian Liver Institute in Hyderabad. Previous to this, I was the National Director of Liver Transplantation and Liver Surgery for CARE Group of Hospitals. Before that, I spent nearly 17 years in London working at King's College Hospital, having done more than about 400 transplants in London before moving to Hyderabad. So one of the questions that people ask me is, what is varices? What is banding? How important is endoscopy for patients with liver disease? My answer is that it is absolutely mandatory. It is crucial. What happens with patients with cirrhosis and chronic liver disease is that because of the disease in the liver, the fibrosis sets into the liver. ये जो fibrosis उसके बाद वो liver को बहुत tight करते हैं. वो tight करने के बाद वो blood flow उसके साथ उसके अंदर से अच्छी तरफ से नहीं जाता है, उसके वजह से pressure बढ़ जाता है. Because of this increase in pressure, the blood vessels inside the GI tract, inside the intestines are often at very high pressure. And sometimes this blood vessels rupture, causing a huge amount of blood loss. ऐसा rupture हो गया तो बहुत blood loss हो जाता है, एकदम अनस्टेबल हो जाता है, फिर इमरजेंसी में एडमिट होना पड़ता है, फिर लिवर आईसीयू में एडमिट करना पड़ता है. सो दैट इज़ वाई ये एंडोस्कोपी इज़ अ गुड इंटरवेंशन दैट प्रिवेंट्स सच रप्चर ऑफ ब्लड वेसल्स. व्हाट इट डज इज इट goes down the esophagus into the stomach, looks for these large blood vessels. If there are blood vessels, we do banding for these blood vessels. Now, this is something that we do in South Asian Liver Institute routinely. हमारे institute का one of the special things is liver care program, what we call lycap. South Asian Liver Institute में lycap करके बोलते हैं. उसमें हमारे लिवर पेशेंट्स को हम ऑटोमेटिकली 6 months एंडोस्कोपी करके ऐसा ब्लड वेसल्स का रप्चर ना होना बोल को वी विल डू प्रिवेंशन so that they do not have an emergency admission, and we will do the banding at a regular interval so that there is no risk of sudden heavy bleeding and then the patients becoming quite sick. Therefore, I feel that all liver patients should understand that a regular endoscopy should be part of their treatment, and I advise them to be part of such a liver care program in their own towns and villages or cities so that they are well looked after. The last thing we want is for a liver patient to have a complication like this, which is fully preventable. Of course, अगर और थोड़ा डिले हो गया तो और थोड़ा सीरियस हो गया और थोड़ा लेट स्टेज चले गया तो फिर बैंडिंग से उतना फ़ायदा नहीं रहता है. देन वी हैव टू कंसिडर a liver transplant. So at South Asian Liver Institute we always try to keep patients away from a transplant, but at one stage the risk to the patient is greater by waiting, and therefore at that stage we will say to the patient that now we have done as much as we can, let us proceed to a liver transplant. So I think similar programs will be there in your towns and cities. Please get enrolled in this if you know that you have liver disease, and that might save your life.